we have been conducting 2 parallel phase 1 dose escalation and expansion studies, one looking at the IDH1 inhibitor Ivosidenib in IDH1-mutated patients, Ivosidenib in the post-transplant maintenance setting, and the other with the IDH2 inhibitor Enasidenib for IDH2-mutated patients as maintenance in the post-transplant setting. The former is still ongoing, although we just recently finished registration for all patients. The latter is much further along, and we concluded registration and enrollment several months ago, so we thought it appropriate to present interim results from the Enasidenib study. To date, I can tell you that we have established a dose in the dose escalation portion, a recommended phase 2 dose of 100 milligrams daily in the post-transplant setting, which is the same dose which is approved in the relapse refractory setting. So that's encouraging. And we also completed an expansion at that dose, establishing its safety and tolerability. Overall, the drug was well tolerated. There were no DLTs, dose-limiting toxicities. Only a minority of patients have developed significant acute GVHD or chronic GVHD, which is aligns fairly well with patients in general who undergo transplant. So it wasn't in excess of what we would expect. Most of the patients that we've followed have gone through the 12-month period, but not all. Among the ones who have finished the 12-month follow-up period, only 2 have relapsed. This data is encouraging, it's promising. Obviously, we need further follow-up for these patients to learn more about the promise in this phase 1 trial, and ultimately we need to do additional study to assess the promise of IDH therapy maintenance. I will say that we hope to have the data for the IDH1 inhibitor maintenance presented at upcoming meetings and hopefully in publication form shortly. And we also have an abstract this year because we actually don't fully understand how IDH mutated patients do post-transplant. So that data we looked at multiple institutions, including us at Mass General, the Dana-Farber, and Ohio State. We combined the data, and we're going to present the outcome of patients who are IDH mutated post-transplant, so that we have a baseline that we can compare our maintenance trials to, in addition to additional trials in the future, so we can compare against that baseline. So all of that, I think, is exciting, and it's going to be presented at this year's ASH.